Good morning, everybody, and thank you for attending our 151st Coronavirus Update. We have two speakers joining Orange County Mayor Jerry L. Demings today who haven't been here for a little while. Dr. Yolanda Martinez, who is our County Health Services Director, will be giving the latest testing and vaccination numbers from all our sites. And epidemiologist Alvina Chu is here in lieu of Dr. Pino. The mayor will be talking about his goals of the week, our latest rental assistant numbers, and where the I Got My Shot mobile vaccine trailer will be located this week. Mayor Demings.
All right, good morning to all of you. Thank you, Jane, for the introduction. First, let me begin by just acknowledging that this past weekend was an extraordinary weekend for all Americans. It was what I call a trifecta of a weekend because of the conflict that we see emerging in Afghanistan, the tropical storm that has now impacted the east coast of the United States, and then the global pandemic that we have been consistently working through and trying to address in this community in a proactive way. So the goals for this week remain, number one, to slow the spread of the dangerous Delta variant in our community by getting as many people vaccinated as possible and encouraging others to wear facial coverings. The second goal that we have for this week is to continue ensuring that there is an abundance of testing opportunities available within our community so that anyone can know their status who desires to know their status of whether they are positive or not. I'll be talking more about that in just a few moments. And then lastly, we will continue to provide our financial assistance to rent-stressed residents through our emergency rental assistance program. And I'll share more about that in just a moment. And just to give you an update, we have conferred with the Department of Health, and Ms. Hsu will certainly talk about the numbers, but here we are as we start the beginning of another week. We now have over 198,000 confirmed cases reported of the novel coronavirus within our community. Last week, I believe we started the week and we had somewhere around 192,000 cases. The number of new cases reported yesterday was 1,278. So we are back to over 1,000 cases reported in one day. The number of deaths in Orange County now stands at 1,480. When we did the press briefing on Monday of last week, we reported 1,452. The 14-day rate of positive new cases within our community still remains around the 20% mark, and it has been at that level now for the last couple of weeks. Ms. Hsu again will get into the numbers, but at 20%, maybe we've plateaued. The good news, if there's any in that, is that the number isn't going up, but it's staying, about the same, and it's still high. It's much higher than what we want to see in our community. We want to get that number down to 5% or below on a sustained period of time. So we have a lot of work to do in this community, and I believe that it is absolutely critical that in order to reach that number, and sooner than later, it will require additional people to get vaccinated. The good news is that the FDA today announced or authorized full use of Pfizer. Up to today, Pfizer was only approved for emergency use. So that signifies something, I think, about the data that has been collected over time by our healthcare experts and our researchers about the efficacy of using the vaccine to combat the pandemic that we're living through. The number of residents ages 12 and up who have at least one shot or more of the vaccine in our county is now it's over 66%. And I think that we are moving up, we're edging upward. Still, I believe that we can pick that pace up a bit. And we're trying to do that through ensuring that we have adequate testing sites and vaccination sites available. Camping World Stadium remains the largest single-site vaccination location in Orange County. Orange County Health Director Dr. Yolanda Martinez is here to talk more about the numbers we are seeing both at Camping World Stadium and our other 3 testing sites. There's some good news here. The sites will remain open through September at Camping World, and those seeking shots will have a choice of either Pfizer or Moderna. Dr. Martinez will have more details shortly, but I want to highlight another testing site option for our county residents. A new drive-through COVID-19 testing site is now open at the Edwards Field, which is in the Apopka area, located at 239 East 1st Street in Apopka. Appointments are available online. Drive up is also welcome. The testing site provided by the NOMI group is open 7 days a week between the hours of 8 a.m. and 6 p.m. The tests offered include the PCR and the swab rapid antigen test. Again, no symptoms are necessary in order to avail yourselves of these sites. For more information on the new site in Apopka, you can go to apopka.net/alert center. apopka.net/alert center. And Orange County's rental assistance program continues to approve applications and funding for residents who are behind in rent due to the pandemic. Nearly 1,300 families have been able to stay in their homes, with $7.2 million has been approved through our program. Tomorrow, our program staff will be at the South Trail branch of the Orange County Public Library System between the hours of 10 a.m. and 1 p.m. to answer questions and to help residents fill out their rental assistance application. For more information, you can go to our website at ocfl.net/rental assistance. And the I Got My Shot trailer is a great success for our community. It continues to traverse Orange County so residents can get a shot at their convenience. This afternoon, the vaccine trailer will be at the Orange County Tax Collector's Office on Sand Lake Road starting at 2 p.m. Tomorrow, Tuesday afternoon, it will be at the Jim Beach Recreation Center on A.D. Mims Road in Ocoee. On Wednesday, the mobile trailer will be at the Healthy West Orange Arts and Heritage Center in Oakland in the morning, and a second trailer will be at Lake Eola between the hours of 9 a.m. until 11:30 a.m. on Wednesday morning. Wednesday afternoon, vaccines will be offered at West Oaks Mall at the Orange County Tax Collector's Office on West Colonial Drive. And on Thursday morning, the mobile trailer will be parked at Orlando City Hall. Then starting at 2 p.m. on Thursday, you can find the trailer outside the Orange County Tax Collector's Office located out off of Lee Vista, which is in East Orange County. And so that's it for the location of the trailer. Dr. Martinez will come forward at this time. Thank you.
Good morning. Thank you very much, Mayor. As Mayor Damien just mentioned, we are pleased to continue offering testing and vaccinations through the end of September at our various locations. Before I give the numbers, I wanted to thank all of my colleagues in the Health Services Department for making this a possibility month after month. They have risen to the occasion from the very start of the pandemic. And I also wanted to thank our partners in the community, including the Orange County Fire Rescue Team that has been very active since the very beginning, the Orange County Convention Center for their support, not only in location but with staff. Our partners in the community, Orange County Public Schools, has been a partner, formidable partner since the very beginning when we started testing at the various schools. Also, the Orange County Sheriff's Office and the City of Orlando. Thank you very much to all of you for your support to Orange County Mayor Demings in this effort. As the mayor mentioned, those going to Camping World Stadium can get vaccinated now and have a choice of Moderna and Pfizer vaccine. Over the weekend, we saw a little bit of interest in Moderna, but not that much. So far, since we started vaccinating at Camping World on August 10th, we have provided over 1,500 vaccines at that location. Over 50% of them are those individuals that are getting their first shot, which is a good sign of people wanting now to get their vaccine. Saturday and Sunday, we saw 368 individuals getting vaccinated. And again, about a little bit over 50% of those were first shots. Please remember that there's no testing at Camping World, only the vaccines. And we are not giving the additional booster at this time. That third booster that is recommended for immunocompromised individuals is not being offered at Camping World yet. What we do recommend to residents is to check with their local pharmacies and their primary providers or healthcare providers for that vaccine. We remain at 3 testing sites, as the mayor mentioned. Over the weekend, the Apopka site, which is located in the Clarcona and the former Clarcona Elementary School, saw a total of 1,517 individuals getting tested, both for Saturday and Sunday. At the Econ Soccer Complex, during the weekend also, 2,734 tests were performed. And at Barnett Park, 3,206 tests. So averaging, or in total for the 3 sites over the weekend, we did over 7,000 tests, 7,457 to be exact. All 3 tests, including Camping World for vaccinations, are open 7 days a week from 9 to 5. Barnett Park, Econ Soccer Complex are very busy, so we wanted to remind you, if you want to get tested, to please get there early. There are times when we have to close the line, and we don't close the testing site until we see everyone, but sometimes when we close the line is because we have already a wait of an hour or more, and we want to make sure that we get everyone out of there on time that went to get tested. Again, I want to echo the mayor's message in prevention, and that is wearing your mask. Social distancing, but most importantly, getting your vaccine is the most important component to be able to prevent this virus from being promulgated. And that's it for me.
All right.
And I would like to invite Ms. Alvina Chu now to come to the phone.
Thank you. Thank you, Dr. Martinez. So as the mayor had previously mentioned, currently we have 198,086 total positive cases reported here in Orange County residents. Over 194,000 of those are in Florida residents. Our recovery rate is encouragingly greater than 99%, and unfortunately our 14-day rolling percent positivity rate is 20.01%. So the rate of new infections that occurs every day is one of the things that the CDC tracks us on, every county in the United States, about what is a high level of transmission. And so greater than 100 is the threshold for new cases, 100 per 100,000, and we are currently at 555 new cases per 100,000 population. The other component to that high transmission level is also percent positivity. So they use a 7-day percent positivity, and that threshold is greater than 10%, and currently for our 7-day rolling average, we are at greater than 19%. Unfortunately, as the mayor had mentioned, we have had a total of 1,480 deaths, COVID-related deaths reported to us, and to the friends and family, we want to express our condolences during this difficult time. The proportion of, so the age group that contributes the highest proportion of cases as of yesterday, which was 20%, was the 5 to 14-year-old age group. And so this is a change from the sort of the previous picture of what we had seen. It remains also the 25 to 44 remains very high, but as of within the last few days, the largest age group that contributes to the newest cases is the 5 to 14-year-olds. For COVID variant cases, of the sequences that we have completed for from Orange County residents, we've had 2,615 Variant cases identified, and 1,265 of those were of the Delta variant. So across the last several weeks, as we had previously mentioned, it ranges greater than 80 to about 90% of all the sequences that we identify, or the variants that we identify within Orange County residents, is Delta, the Delta variant. And so this reflects what is happening in the United States as well, where the predominant strain occurring right now is the highly contagious Delta variant. The age range for those cases is 0 to 97 years, with the median of 34 years. And we've had a total of 18 deaths attributed to those variants, 4 of those of which are Delta. For breakthrough cases, we've identified 1,716 Orange County residents who have who have had a breakthrough case, meaning they have become positive or ill after being fully immunized. Most of these cases, about 50%, but half are symptomatic. Most are asymptomatic or mild cases. Hospitalization rate continues to be very low, as well as the death rate. So greater than 95% of cases are occurring in those who are predominantly unvaccinated. I know the breakthrough cases get a lot of play, but it is a very small percentage of the increase of cases that is happening now. Very small percentage happens in vaccinated persons, and predominantly the pandemic is spreading in unvaccinated persons. In Florida residents, we've administered a total of 2,833,961 doses of vaccine. At least for those who have had at least one dose of vaccine, as our orange graphic had shown, it's 66.07% of the eligible population has received at least one dose of the vaccine, and that includes the Pfizer and the Janssen vaccines. Encouragingly, greater than 83% of our residents who are 65 years of age and older, are one of our most vulnerable populations, has received at least one dose of vaccine. And for those who are 12 to 17 years old, greater than 51% or 51.94% have received at least one dose of vaccine. This week was our first week of testing at local schools. We have designated Florida Department of Health and Orange County testing sites at one school in each of the 7 areas of the Orange County Public School District. The locations are listed on the Orange County Public School website. Just a reminder, these sites are intended for testing of school-age children, their family members, and Orange County Public School staff. And the excellent news that the mayor had brought up, the Food and Drug Administration, or the FDA today, has granted full approval to the Pfizer coronavirus vaccine for those who are 16 years of age and older. Regulators are still reviewing Moderna's application for full approval of its vaccine. That decision could take several weeks, and Johnson & Johnson is expected to apply soon for full approval. So for all of those who are waiting, we hope that this will encourage you and give you the confidence to get your vaccine. Thank you, and I'll turn it back to Mayor Demings, and I'd be happy to answer any questions.
All right, thank you, Ms. Yu. Also, we are joined today by Commissioner Wilson and Commissioner Gomez-Cordero. We also have in audience Mr. Scott Howard from the Orange County Public School District. If there are any questions in Spanish, we do have Ms. Ilia Torres, who's here to assist me with translation, but Dr. Martinez is also fluent in Spanish, and so with that, we'll open it up for any questions. There is a microphone that is moving around, so we will pay attention to it.
Lauren Seabrook, Channel 9. My question, I think, is probably for both Alvina and Dr. Martinez. People are starting to ask us about what the process will be like when the general public can get the booster shot. I assume you guys probably are working on that plan. Can you give us some details on how that might work?
Yes, thank you. We are actually planning. We started planning last week. This week we do have a joint meeting with the health department to continue planning on that. So we are thinking about it, even though we are not open for that booster yet. Well, it's not available yet, but we are planning. Mm-hmm.
Will it be in different age groups or anything, or will it just be everyone?
Well, we'll have to look a little bit at what the health department did originally, because you might remember the original vaccines that started at the convention center were administered by the health department. We are sort of, with the other sites, picking up those individuals that are now wanting to get vaccinated. So we will work with the health department closely on how to determine the age groups or the groups that we're going to vaccinate, and decide from there on, and of course let everybody know.
Bob Hazen from West 2. Mayor, today the county is going to be meeting.
Microphone.
I just wanted to make one point, is that the booster shot is highly recommended for those who are immune compromised, and so really we should focus on the vulnerable populations, those who are immune compromised, to receive the third dose.
Okay. All right, Bob Hazen from West 2. And Mayor, today the county is meeting with the firefighters union about the vaccine requirement for county employees, and we also understand there's going to be some sort of protest outside that. Just wondering how much resistance you've gotten from county employees, and also your message to the firefighters who are going to be protesting about this mandate.
It's hard to gauge how much resistance that we receive, but I will say that we certainly respect the negotiation process with our collective bargaining units. The Fraternal Order of Police, which represents our correctional officers, has tentatively agreed to the provisions by sitting down at the table. We will continue to have those conversations with our firefighters and the representatives there. So we'll see what the next few days will bring for us. In terms of the overall county employee, I get mixed reports sometimes, but the overwhelming majority of our county employees understand what we're trying to do in this regard. Unfortunately, I have to report that we have several county employees who are now in critical care units. They're very, very sick. And we've had several county employees who unfortunately have passed. And so that resonates with their co-workers, that this experience is truly real for many of our employees, and the goal that government has sometimes is to protect individuals even from themselves. And so this is a public health crisis that we're dealing with, and we have made some decisions that some may think were tough decisions, but for me, I've spent a full career of saving people's lives, and sometimes saving them from taking their own life. And I can tell you that that's the fundamental reason that government exists, is to keep the people safe. And in my leadership role as the county mayor, it is to do just that. And so I'm going to continue to focus on saving people's lives, and in this public health crisis, this pandemic, where we see every day new people dying as a result of it, I'm going to stay focused on the mission, is to preserve human life. Okay,
This is,
the mic's in the back, but it will come forward. All right.
all right, this is Melissa Thomas of Florida National News. This question is for Alvina Chu. This is more of a follow-up from the last time you were here. So I wanted to find out, because it's been a big gap there, but do you now see any further variants that are of concern? Previously, you had said you guys had reached up to about Lambda, but are there any that are reaching the level of concern that we're currently seeing with the Delta variant?
So we have not yet, in Orange County residents, identified any other additional variants of concern. There is tracking, so you can see on the CDC website there is tracking of all different kinds of variants, and we do have genomic surveillance that is established here locally and in conjunction with the state health department to keep an eye on what variants might be circulating. Part of it is we're looking for the unknown. So we're tracking to see if there are severe cases and whether or not those are caused by something that we don't yet know about. Thank you.
And Dr. Chu, I've got another question for you. Sorry.
I'm
Rachel
actually not a
Press,
doctor,
News
even though the
sorry.
mayor teases me about it. I think he's
Sorry.
encouraging to get me to get my doctorate.
I'm wondering if you can speak a little bit more to the shift that we're seeing as far as the highest number of cases coming from the age group being 5 to 14 years old. Do we know what might have led to that shift? And if you could speak to what we can do to really combat that, considering that the majority of that age group is not eligible to get vaccinated?
So I think Dr. Pino had mentioned this at the last press conference that we had, and is that what happens in schools and in those children is a reflection of what's happening in the community. So the high level of transmission there, and so to protect those who are unable to be vaccinated, we encourage everyone to continue their pandemic precautions and to get vaccinated. So the more we build up the community immunity, the more we can tamp down the community transmission and help protect those who are not able to be vaccinated yet.
Do you know what led to that spike or that shift?
It's not necessarily, one part is people getting back together, but it's not necessarily just a spike or a shift or sudden like crystallizing event. So as we have done such a great job in vaccinating those who are older, what remains is the younger unvaccinated population. And so we've shifted where as I mentioned, the pandemic is predominantly occurring in those who choose to be unvaccinated and in those who cannot be vaccinated. And so the age range shifts down as to those where the virus can circulate.
Mayor Demings, to follow up to that question, was she mentioning about the 5 to 14-year-olds making the highest proportion of cases? Are you urging the school district to impose a mask mandate despite what the governor's order is and threatening to cut some funding? And have you spoken with Superintendent Jenkins since Friday when she spoke with the White House?
I have, on a regular basis, had conversations with Dr. Jenkins, the Orange County Public Schools Superintendent, as well as some of the other school board members. They are elected to make some decisions on behalf of the students, the over 200,000 students here within Orange County, and I respect the positions that they're in. I also will say this, that I believe that given the current experience with the rate of infection amongst children, I have 4 grandchildren in the Orange County Public Schools, most of them in the elementary age. I believe that some form of mask mandate is appropriate at this time, given our experience. But the decision there is not mine. The decision is that of the school board. And I know that they have additional conversations about where they will end up. Mr. Howard can perhaps speak to that when the school board may take up this matter again, but that is the position that I have, that I believe that given what we're seeing, it probably is the right thing to do.
Have you spoken with Superintendent Jenkins since Friday, and if so, what did you guys talk about?
I don't know if it was Friday or not. I just don't keep track of it, but it was towards the end of last week I had a conversation with Dr. Jenkins. About the mask mandates and the current experiences within the school district. Okay. Scott, we'll ask him to come forward from the school district. He can talk on behalf of the school district.
Thank you, Mayor. Just to follow up on your conversation, yes, the board today is having an executive session to speak to or discuss the lawsuit that they're a party to in South Florida. There's a case down there in which masks are the subject, and the governor is the defendant in that case, and we're a party as the school district enforcing the law under the governor's executive order and the FDOE and FDOH's rules. So they're having a meeting today to discuss that, to discuss any other type of court proceeding or any kind of lawsuit that would be coming forward, any legal action that they would be taking. That'll be behind closed doors in executive session. And then the board meeting tomorrow, there's nothing formal on the board meeting for tomorrow. However, they can always bring up issues at the end or put something on there as an emergency to address the mask requirement. Just a reminder, we do have a required mask policy. You can opt out. Parents can with a note. That's K through 12. So any student that doesn't have a note would be expected, would be required to wear a mask. And so the last data that I saw, we were looking at about roughly 7 to 8% of our students that have opted out of that mask requirement as of now. And we should have updated data on where that is this week. So thank you. Thank you, Mayor.
This is Steve Hudak from the Orlando Sentinel. I'm curious for you, Mr. Mayor, Alvina, and Yolanda, if each of you could answer this. The news that the FDA has approved Pfizer, how does that change your strategy to try to get people vaccinated? I kind of made a joke about it earlier when what's going to be the excuse now? So what's the strategy?
Go to Dr. Martinez and Ms. Hsu. They can give you their opinion, and then I'll give you mine.
That's the leader.
Well, the strategy remains the same, and that is to stress the importance of the vaccine. And the data that Ms. Chu has presented here today speaks to that. The majority of the people that are in the hospital now with serious cases are individuals that are not vaccinated. So that in itself reflects the importance of the vaccine. So we will continue to encourage it and continue to tell people that vaccine is the right way to go to prevent serious illness, and be there and offer it. If the demand exhausts our capacity where we are, we will create another venue for the community to be able to get vaccinated, but we will continue to stress the importance.
And just to add on to, there's the focus on people who can't be vaccinated. And so we hope the message goes out there that if you want to protect those who can't be vaccinated, that you get vaccine yourself. And then we can increase the community immunity here to reduce the amount of transmission.
You know, each day I get a number of emails that get written to my office from constituents on both sides of the coin. As we have neared today, the majority of them now are in support of the vaccine. But there, I believe, is a portion or segment of our population who articulate in the emails to me that their hesitancy is centered around the lack of data, science. Well, by the action that was taken today by the FDA, when the FDA makes approval for a full or permanent use, and it's not an emergency use, they only get to that point when they have looked at the science, the data. Because of the last 18 months or so of what has happened around the world with the World Health Organization and the data that is collected there, what we have collected now in the United States of America and in every state within the Union, they have an abundance now of data where individuals who have been vaccinated have responded in certain ways to being vaccinated. And they're using that to now say that the risk of unintended consequences is very low. The risk of preventing yourself from getting the virus is a much better proposition for Americans, and I believe that that is where we find ourselves today. And so I'm encouraged by it. If you were one of the people who were sitting on the fence because of that, you should be getting off the fence at this point and getting vaccinated. So we'll just have to see if that really was the reason why people were sitting on the fence, or there was some other reason that they were using, and that was just a means to create confusion and conflict within our civilized society. And so no matter what we do, I believe that there's a group of individuals that, irregardless of what the experts will say, their purpose is to create confusion and conflict. But the job that I have is to make decisions in the best interest of all of the information that we receive, and that's kind of where I fall down on making my decisions in terms of public safety for the greater good of all mankind. All right, so there we are.
Last but not least, Holly Bristow, Fox 35 News. So last week, you invited us all out to the water treatment facility there. What are their studies showing at this point? Where should we expect the next spike in terms of location in our community, number one? And just to follow up on that, are you going to be asking for a limited car wash sprinkler use like the City of Orlando and City of Winter Park have done?
I think those were prudent decisions and requests that have been made by Orlando and Winter Park based upon their water use rates. We have from Orange County Utilities, Ms. Sarah Lux, our public information officer from that area, who can come forward and share with you some of the recent data or information from our Orange County Utilities. So I'll ask her to come forward at this time.
Thank you so much, Mayor. Yes, so we do have 3 facilities as of right now that use liquid oxygen to clean water. That's not a majority of our facilities, it's only 3. At this time, the shortages are not impacting our customers in any way. If that changes, we will let you guys know. We are actively monitoring it, but at this time, it's not affecting our customers at all. If you want to get with me after this, I can give you the exact numbers for each of our wastewater testing plants so that you can get the most updated numbers for that. Right, with the COVID numbers, exactly.
On Friday, we were seeing the numbers come down in our 3 different sites, but the Eastern water plant where we did the press event last week still remains the highest. Second was the Northwest quadrant, and the last was the Southern water plant. Had the lowest numbers. So in terms of geographically, Sarah will share the specific numbers with you, but the numbers in our Eastern water plant were still probably 10 times what they were previously. I think we were at the 200,000 parts per liter, and we were still in the 2 million range. Sarah, you wanna add anything now?
So I can't speak generally. So and in May, when we started testing all of these, we were at 200,000 parts per million generally for all 3. The southern and eastern water reclamation facilities are both over 1.4 million as of results we received this morning. So they have gone up. We did see some decreases for a couple of weeks in a row. However, specifically the southern water reclamation facility has gone back up. We still see Eastern trending down slightly, but without those numbers directly in front of me, I can't show you guys the trend, but again, if you'll reach out to me after this, I can give them to you. But we do see Eastern and Southern both above 1.4.
This next question was texted from Shannon Butler from WFTV, and this curtails another question relating to the Orange County firefighters for Mayor Demings. Can you ask the mayor for me, where are we with vaccine negotiations when it comes to the Orange County Fire Rescue Department?
As I said, we're still at the table with the firefighters. We will continue to have those conversations and discussions to try to get them more comfortable. Obviously, our firefighter, paramedic, EMTs are on the front line here within our community, directly touching into hospitals and taking care of them in their homes. And because of that, we have this responsibility to make sure that we not only protect our employees, but also those residents, those patients who are our firefighter, paramedic, EMTs are touching as well as they go into people's homes. So this is why we have made the mandate that we have in place. We believe that it's an appropriate thing at this time, given the challenge that we have. Our firefighters don't get the chance to decide whether or not they're going to respond into someone's home for a 911 call. They must go. That is the directive. That is a job that they have to do. And as such, my goal is to protect the public as well as other employees from the spread of the virus within our community. Yes. So the question is whether or not today's announcement by the FDA with the full approval for the use of Pfizer, if that changes anything for us legally. I'm not an attorney, so I'm not going to opine from a legal perspective. But what I will tell you is that before we ever placed or made the mandate here within Orange County, I sought legal advice from the county attorney's office, and the county attorney's office has, opined that we are well within our right to do a mandate for employees, and that is inclusive of those who may be represented by collective bargaining based upon the current state of the pandemic within our community. Also, I will tell you that historically, many of our employees who work in certain categories, they have been required to be vaccinated in order to meet the minimum criteria for their respective jobs. It's not really unusual to have vaccine mandates in place, particularly when we send them into this special risk environment where they cannot choose to go into certain environments. They must go because we are directing them to go. And so as much as anything, the decision that we have made here is all about protecting them and protecting the others that they have to respond to.
This last question comes from Darlene Jones from WFTV, and it's directed at Scott Howitt in the school district.
All right, Scott.
Her question reads, has the district implemented temperature checks again at schools, and are some schools requiring children to be tested for COVID-19 before returning if they are sent home with one or more symptoms of COVID-19?
So two things. We have random temperature checks. I mean, all of our schools have the electronic thermometers in order to check. So we've been doing that all along. As far as returning, they can test out of quarantine on the 5th day, if in fact, and our protocols are out there on our back to school FAQ page that you can locate on the front page of the website at ocps.net. The decision tree's there for students, so they can test back after 5 days if there's certain protocols in place, if they actually have the virus, what they need to do in order to return to school. So all of those are on that decision tree that's on our back to school FAQ page. So thank you.
It was the part of the question is if you have symptoms but are not yet known to be exposed or quarantined. So you can, yes, the child would go out, you would find out if it was COVID or not, or they can come back with a doctor's note stating that it isn't and they are allowed to return to school.
Okay. It appears that is the last question for today. The next press briefing will be this Thursday, and we will be doing the press briefing at 4:30 p.m., so August the 26th at 4:30 p.m. Thank you all for joining us today.